Thank you so much for having me speak this year. Good morning. My name is Justin Berry, and I'm faculty member at Northland Community Technical College. I have been the program director there for, this is my 15th year when the program started. Regarding burnout and physical therapy, I've done a lot of research on this topic and related topics and done a lot of presenting at the national and international level on this topic. It's just a really interesting area, and there's a lot of different things that we're going to talk about today that are kind of, I think, important for students to know going into the profession. I first got interested in this topic because I realized that most research regarding burnout and related factors was quite dated in physical therapy, and some things such as productivity requirements and student loan debt just had no research on them, which also helps, which also is important for burnout. So first thing is, what is burnout? So burnout itself, the early definitions of burnout were not very good. They first stated it was like a loss of creativity or a loss of commitment for work. They said it was like a response of stress due to work success or work, just too much work. And it just had really lacked a common and precise definition. Here's a couple other studies here that just showed articles that had a couple other definitions of burnout, but mainly people think of burnout as you're just overwhelmed, you're just physically and emotionally exhausted due to work stresses and demands. This is what burnout is not. So here's a picture of a guy that, you know, it says he's not burned out. If you're 14 years away from walking out the door from your job, he has stress in his job, but he's definitely not burned out. Some of the earlier research on burnout looked at animal models. The first time they looked at why humans and animals were stressed took place back in the 30s. And this is interesting. This was some research that took place in Canada, and they were looking for a new hormone in the body. At that point, hormones were all the rage. They were trying to determine if there were some additional hormones in the body. So they were injecting rats with extracts of a lot of different things. They were injecting them with toxic liquids to see if hormone levels would change, and then they would inject them with water. And they were surprised that the rats, no matter what they injected them with, would have like the same stress-like symptoms. So they realized that multiple injections of anything over a certain amount brought on too much stress, causing illness. So because of this is kind of the first time looking at how stress impacts the body and how too much stress, even in a work-related environment, can lead to illness and other problems. Stress, in a little bit, is important. And this is kind of, some studies talk about this. Is called the Yerkes-Dodson law, that states that your performance increases with some amount of stress or expectation, but when it becomes too much, then your performance decreases. Help to handle anything. Some states are not a clinician, where you have a very high patient load, you'll do whatever you can do to try to meet the expectations of your employer. But if you can see on the study here, it's good to have some stress. You don't want to have a boring job where maybe you only have a couple patients a day, but if it gets to be too much, then you can start to get job strain and get exhausted. And if that continues, then it can lead to burnout on the job. This is another a model called the general adaptation model. It also shows that if you have stress for a while, it's okay, your body can cope with the stressor for long periods of time, but after a while, you will start to get exhausted and you're not going to have a problem. You're going to have a problem just for long periods of time putting up with long periods of stress. This is one of the reasons too, these studies about general adaptation syndrome leads to a condition called leisure sickness, they call it, where some people with really high pressure jobs, when they go on vacation, when they finally get a chance to relax, they get sick. And I don't know about you guys, but when I was in PT school, I'd get really sick every year during Christmas break and after the spring semester. And even teaching, I still usually get sick most years over Christmas break. It's because my body is, it's putting up with stress for so long of high workload, and then when your body finally gets to relax, it realizes then, okay, that's when your defenses are going to be down and you can get sick. I'm kind of going back to burnout research, though, and the history of it is back in the 70s and early 80s, there was a lot of research done to determine what led to job burnout. And it found that individuals that have jobs that deal with people, whether it's healthcare professionals, teachers, social workers, police, fire, fighters, all those tended to have high levels of stress versus people who didn't work with other people. So people that work in human services occupations tend to have, are much more prone to burnout. Burnout itself is going to be characterized by 3 different things. This is kind of the most common now, kind of more current definition of burnout. It's a 3 component conceptualization by Maslow and colleagues. Emotional exhaustion, that's just lack of energy and feeling that one's emotional resources are caught up. That's usually what people think of when they think of burnout, is that emotional exhaustion. You just feel fatigued and overextended due to one work. Depersonalization describes feeling indifferent and distant. In healthcare, from one's patients, you just think of them as numbers. You don't really think of them as people anymore. And personal accomplishment has an inverse relationship to burnout. And that's going to be the feelings of satisfaction you have from your job. So the higher your level of personal accomplishment for your job, the lower your level of burnout. I think the best definition of burnout is my son, who is in 7th grade now, when he was in 3rd grade, I found this next paper I'm going to show you guys at the bottom of his backpack. He had an assignment one day at work where his teacher said, I'm going to have you guys all work in a shirt factory. And I'm going to give you guys all a job in the shirt factory. And you have to write a sentence to tell me about your job making shirts. And actually, I think this is like 1st grade or 2nd grade. I can't remember. He was pretty young. So his job was going to be folding the shirts in the factory. So this is what he wrote about folding shirts. So his handwriting is about as bad as mine still is. So yeah, I fold all the shirts, I hate my job. So right there, he hadn't even started working in the factory yet, but he already had some definite feelings of job burnout going on. And that's kind of what people who are burned out, we're gonna talk about some of the signs and symptoms are gonna be. It's beyond just hating your job. It's when you wake up in the morning, it's dreading going to your job every day. And even taking a vacation for a few days, coming back, it doesn't help. There's a model I wanted to mention to you guys too about that really fits in with burnout development. And this is called the job person fit model. And what it states is it focuses on the amount of fit an individual has within these 6 different work-life domains. And if a significant mismatch occurs between an individual and their job, the likelihood of burnout development is high. PTs and PTAs may be at increased risk of developing model due to several issues of the model. High workload is one. With high workload is the most related to the emotional aspect of burnout. So if you're at a position where workload is high, that increases your chance of burnout. Autonomy is another one. Again, autonomy is how much freedom you have to do your work. We're going to talk more about autonomy this morning too. Some individual places that has high productivity requirements, that would be decreasing autonomy. I've heard this too from individuals working in skilled nursing facilities. If it's nursing or administration saying what level of rehab patients should receive for reimbursement versus the therapist, that could be a problem too. Slow gains in salary over time is another thing with deficiency in rewards. If it's small departments for physical therapy, that may also have decreased community. And we're going to talk about feeling compelled to act unethically, especially regarding a really good study that came out last year about productivity in a little while. With the unethical portion, there's an area called moral distress, and that can lead to burnout too, where when individuals experience loss of personal and professional integrity, and when their desire to maintain professional standards cannot be realized where they're at due to pressure from their employer, that will make it difficult, especially if that person feels compelled to stay at their job for some reason. There are a lot of negative impacts of burnout. Looking first at workplace issues of burnout, productivity can go down, employer turnover can go down too. One study from 2007 found that the cost of turnover for RNs is estimated to be about 1.2 to 1.3 times their salary. So it's not good for institutions to have high turnover for their staff. Physicians who are burned out point to the possibility that physician studies about burnout find that when physicians leave a facility, they will make more referrals and order more tests. Another thing too is when individuals are burned out and disengaged from work, the quality of their patient care and their efforts that go into their daily work will suffer quite a bit. couple other workplace effects of burnout is there has been a significant correlation between degree of depersonalization. And again, that's just feeling like your patient is a number, and patient satisfaction and patient adherence to advice. So if you're burned out, your patients aren't going to be as happy with their care, and they're not going to be as happy with listening to you too. Also found burnout to be a predictor for more medical errors and medical malpractice suits. Health effects of burnout, there's a lot of these too. Individuals that are burned out tend to have more anxiety, headaches, difficulty concentrating. There's some studies show they may have even increased, next slide talks about that, increased use of smoking, drug, and alcohol use. So it's bad for employers and it's bad for employees to have burnout. A couple other effects, like I mentioned, potential increased use of smoking, increased absenteeism. Individuals will just call in sick more for work. There's a lot of understudied areas though too. Is there increased fraudulent billing or under treatment to avoid patient contact potentially if people are burned out? How's their documentation? I guess nice thing we'll talk about electronic medical records here in a bit too. And it's a little harder now to stay behind on your notes. I know when probably about 15 years ago, a facility I worked at, when we still had we still had some written notes. There was one PT who was about a year behind at one point on their notes. And they had to come back into work, and they were pretty burned out, but they had to come back in and for 3 weeks straight just work on documentation, not see any patients. And I don't know about your memory, but I could not remember what I did with a patient a year ago specifically over 5 or 6 treatment times. That was a little difficult. Next is burnout signs and symptoms. This is going to be, like I mentioned earlier, if you wake up in the morning not wanting to go to work is a big key sign. Everyone has some good days and bad days at work, but if it's constant, you just dread going to work. That is an issue. Also, a sign of depersonalization is if you just feel detached from your patients. You may not use patient first language or think of them as people. Also, just withdrawing from work and colleagues, taking longer breaks. I know I worked with one individual I think was pretty burned out. They tended to just put a lot of unattended modalities on patients and then just go sit in another treatment room by themselves and be on their phone or be in the bathroom for 10 minutes. And that's probably a good sign of burnout if they're just trying to stay away from everybody. For other things too, it's going to be things such as increased illnesses, concentration, lack of productivity, poor performance. All these things are going to be signs of burnout too. And I'm always a big fan of doing Google image searches to find out things. And from the Google image searches for burnout signs and symptoms, it found a really big burnout sign is if you are working with somebody and they touch their face a lot in meetings, that's going to be a sign of burnout. Because pretty much if you look up burnout signs and symptoms, that's what you see on the Google image search. A couple things to talk about for personal institutional characteristics of burnout. And then we're going to get into the research about burnout and physical therapy and kind of some of the other things that's going to be important to think about as a student and new professional. Studies across all populations of workers, not just healthcare workers, but they found that women tend to have higher rates of emotional exhaustion than men. Newer research into burnout is looking into that more, and they also are asking individuals not only aspects about their job, but asking about the percent of household chores and duties someone performs. And they're finding that if it's a pretty strong correlation, if someone says if they're married and a partner, if they're doing 80% of the work or 75% of the work at home besides a full-time job, that also increases burnout too. New studies have also included the number of children and how young the children are, and they found that the number of younger children at home tend to increase work burnout levels for both men and women. Besides that, studies also from across all populations always tend to have men having a higher rate of depersonalization. And burnout rates tend to be a bit higher in a lot of populations in women versus men, but not all. Age is another one too. Age is most consistently related to emotional exhaustion levels. They found younger individuals report higher levels of burnout. With the children thing too, younger individuals working are more likely to have young children at home. Some things I've talked about too is when you are starting out working at jobs, you probably aren't doing everything you want to do. You might have to work more weekends. You might have different shifts. I know there's some outpatient clinics now that the newer people, they're working kind of maybe 10 to 6 or 11 to 7 at night to keep the clinic open more. Kind of like the old, saying that crap runs downhill too a little bit is when some people are new working, they may not be doing everything they want to do. And it takes a little while to get seniority to be doing some different roles. Career advancement, same thing. They found that individuals who have greater upward career movement may experience less burnout. That could be due to more salary. But they think in healthcare, it may be due to less patient contact too. If you are now a therapy supervisor, maybe you're only treating patients half time and doing administrative work half time too. That's a big question right now going on in the profession too, is what are facilities doing for career ladders for PTs? A lot of places are having, making sure that there is more opportunities for advancement for PTs and PTAs. Looking at burnout in healthcare, we're going to talk about a couple of studies about these, and then we're going to talk about specifically for PT. This is a study from Canada, and this is kind of a little old, 2007, but there hasn't been a lot of newer studies on this. This found that a lot of individuals reported most days on the job were pretty stressful. And one thing I want to point out is physiotherapists in Canada at that point were one of the least stressful occupations. Comparison, 29% of physiotherapists in the study reported high stress levels compared to 67% for nurse supervisors and 64% of lab technicians. One thing they found too in this study is the less people made for salary, they tended to have higher levels of burnout. Now this was kind of interesting because they didn't really use a really good tool for burnout. They just asked stress level. Most burnout studies though use what's called the Maslow Burnout Inventory. And it asks questions in 3 different domains. And if we were in person, I would have had all of you guys take this survey today to see kind of where you guys are at for burnout right now. It's early in the semester, but I know it's kind of a weird semester, so burnout wouldn't have been probably too bad. If I would ask you guys to survey maybe end of November, it would be a little different though for burnout getting ready for finals. But this is going to cover emotional exhaustion, depersonalization, and personal accomplishment. A good thing about this survey is it's used a lot. And most of the studies we're going to talk about next use this survey. Before we talk about PT and PTA, here's a study. It's an old study there's a couple old ones here we go. Old one for burnout in occupational therapy. This was in 1988. They found that OTs tend to have moderate emotional exhaustion, low levels of depersonalization, which is good, and moderate levels of personal accomplishment. They also found that there's a negative correlation or inverse correlation between age and depersonalization and personal accomplishment. So the older one got, the lower the levels of depersonalization were too. One thing though, that's an old study, and like I was going to mention, a lot of these studies about healthcare burnout are old. I mean, this is 1988. There's no electronic medical records then. Here's a picture of a cell phone from 1988. A lot has changed from 1988. To give you an example, here's me in 1988. So as you can see, and this is actually, this is me at the state science fair as 7th grader. I thought it was really cool making the state science fair. I was all decked out there. So thing is now I still present like research at national conferences. So I guess not much has changed, but I really wish I still had those glasses. I would definitely have worn those today for you guys. Looking at burnout in physical therapy, there's been some studies, but most of them are pretty old. Here's a couple studies. And one unfortunate thing is a lot of the studies have just looked at very specialized populations. Here's one that just looked at inpatient rehab hospitals in Massachusetts, where they found that there was a fair amount of burnout. Another one just looked at orthopedic physical therapists who were members of the orthopedic section of the APTA. So they are good studies, but you can't really generalize them to larger populations. Here's another study looking at just physical therapists in New York City. And this was PTs and OTs together. And they found people were very burned out at this point in 2002. Now, one thing about this is 2002 was when it was published, but the survey took place in 1998. And people are very burned out. So I don't know, from any of your classes, do you guys know what happened in around 1998 in regard to physical therapy, which may have burned them out a bit more? I realize some of you were not, born in 1998 or 1997.
Wasn't there like a shortage of jobs?
Huge shortage of jobs. There was the Balanced Budget Act, which was passed in 1997, which really impacted Medicare rates. Like I graduated PT school in 2000, and there was almost no jobs in 2000. It took a couple of years for things to bounce back. So with that, that's an unfortunate thing they didn't talk about as a limitation in the study, is they asked about burnout at a time when people were really stressed and there were not jobs, and people were getting fired within the profession. Okay, another study. This was a study that myself and a colleague had published about 5 years ago, and this is looking at burnout of very rural physical therapists. And we decided to look at this because studies have found that there is a shortage of medical professionals in rural areas. And we thought PTs in very small towns may be at increased risk of burnout because they might be the only person there. They probably have high workload, don't have help. And they might have not much professional development to let them know. Studies have found that healthcare providers within rural areas tend to work longer hours and see more patients and work with a lot less support. We thought that could maybe lead to increased turnover. How we decided what rural areas to look at is we decided to look at what are called frontier counties. And frontier counties are counties with 6 people or less per square mile. So everything in green here from the 2010 census was frontier counties. So we looked at all the counties that were frontier counties in North Dakota, South Dakota, Montana, and Idaho is what we looked at. So we sent all those individuals, we got mailing lists, sent them all surveys, seeing their burnout levels, and they had to both work and live in a frontier county. What we found was kind of surprising. We found that predominantly living in the middle of nowhere, these individuals have really low levels of burnout. We thought they'd have high levels of burnout. Most of them had low levels of emotional exhaustion. Depersonalization rates were low, which is great. They still cared about their patients, and personal accomplishment was very high. So I guess that's one thing for you too, is if you are concerned about getting burned out, moving to a super tiny town may help you out. We did recommend with this too, that this might be a good recruitment tool for rural healthcare facilities, just to state, hey, you know, this might be helpful. One reason we thought that depersonalization rates were very good was if you work in a very small town, you know everybody. If you have a patient, he probably is a person at the store or your kid's teacher or lives down the street from you. So it's probably more of a strong community just all by itself, even if there's not a strong professional community. Another study of physical therapists. Here's one that I did that I presented at APTA's Combined Sections meeting last year, and this looked at burnout among physical therapists. And again, I've been doing some research lately on this, just trying to get some updated information. With this, there's high levels of emotional exhaustion overall, moderate levels of depersonalization, and high levels of personal accomplishment. So the emotional exhaustion was a bit of a concern. Found that individuals, the longer they worked, they tended to have higher levels of depersonalization. There's also a significant positive correlation between hours worked per week and emotional exhaustion, depersonalization, and personal accomplishment. So if people were working 50 hours a week, they tended to have more burnout, which makes sense. Looking at PTAs, here is a study that myself and some students performed a couple of years ago about burnout in PT assistants, and we talked to PT assistants in the Dakotas and in Washington State. And it's very similar to the last one for PTs, tended to have moderate emotional exhaustion, low levels of depersonalization, and high levels of personal accomplishment, which again means low burnout. Same thing as before, people with over 10 years of experience, higher levels of depersonalization. And that's one thing to think about is in your career, after you work for a while, that's something to notice, that if you start to just not care as much about your patients, then you might want to try to get some type of intervention to try to decrease that too. We looked at this for PTAs, back to that job person fit model of the 6 domains. We thought there were some specific things that PTAs may fit in with that. Decreased salary, higher productivity requirements at times. One good thing though is there's significantly less student loan debt for PTAs, especially looking at debt to income ratio. And we're going to talk about student loan debt with DPT students in a little bit too. Burnout doesn't sit there by itself though. It kind of sits with other things. Autonomy is going to be part of that job person fit model, or how much freedom you have to do your job. Job satisfaction is important too. Studies have found that your higher your autonomy is, your burnout's lower. the higher your job satisfaction is, your burnout's lower as well. So autonomy, like I mentioned, the higher your autonomy you feel about your job, the lower your burnout is. Also, the higher your autonomy is, the higher your job satisfaction is. And that's an important thing too to look when you look at jobs is how much freedom are you going to have to determine your treatment plans and your schedule and things like that. Here's another study that I presented at CSM last year that looked at autonomy of physical therapists in North Dakota. And with this, it found that a big thing is subject to the productivity requirement. Most places have productivity requirements, but people with a productivity requirement had significantly lower levels of autonomy, perceived autonomy, which could increase burnout rates if productivity rates are too high. Also, APTA members had higher levels of autonomy, which is great. And being clinical instructor also did. So that's some things you can do too, is get involved with your professional organization and being clinical instructor. Those things can help really decrease the chance of getting burned out. Job satisfaction is important too. They found it's inversely related to burnout. It's kind of a chicken or the egg thing though. Is one lead to another, or are they just both concurrently happening? This is a study looking at, this is the only study that I'm working on getting this published right now, hopefully soon. I presented this at CSM this year, looking at job satisfaction of physical therapists and physical therapist assistants. Overall, PTs and PTAs had very high levels of job satisfaction. And very surprising, the job satisfaction levels for all the different areas we looked at were the same between PTs and PTAs, except PTAs had a higher level of job satisfaction regarding their working conditions than PTs. And we don't know why that is. It may be not having to deal with evals, not talking with insurance companies as much, but PTAs did have a higher level of satisfaction about what they did on the job. With this too, female PTs, PTAs had higher levels of job satisfaction regarding their nature of work than males. And APTA members had higher levels of job satisfaction regarding promotion opportunities and the nature of their work. Another big thing with productivity requirements down here, individuals with productivity requirements had lower levels of job satisfaction for all areas studied, except for coworkers. Everyone was happy with their coworkers. When comparing job satisfaction levels, this is a tool called the Job Satisfaction Survey, which has questions on all these constructs. Here's PTs, PTAs from this study compared to norms for just a bunch of professions across the board. And you can see PT, PTA is higher for everything, which is good. And that's why often physical therapy is always listed on one of the top 10 jobs for job satisfaction. Okay, now we're going to get to the fun stuff. We want to talk about some things I think it's really important for students to know. Some other contributing factors for burnout, for PT, PTA burnout. A big one is student loan debt, especially for PT students. Studies have found, if high levels of debt can cause factors for long periods of time. They found it can delay making major purchases such as a home or a car and delay starting a family. Also can influence decisions about where to work. They found too that higher levels of student loan debt can decrease psychological well-being for some individuals. Okay, so here is a study that I just did last year. I just presented it, and I'm working on hopefully getting this published soon. I have it submitted to a journal. With this, heard from about 600 PT students at the time of graduation what their student loan debt was. For students with student loan debt, the average debt, and this includes both undergraduate and DPT, was $103,000 for public institution graduates and $138,000 for private. The one thing I thought was really surprising with this is there was a number of individuals that had $200,000, $250,000 in student loan debt at the time of graduation from PT school. A lot of people were concerned. A big concern too is 75% of the individuals in this survey with student loan debt would not qualify for a 10-year loan repayment period. They would need either a 25-year repayment period or a 25-year graduated repayment period to meet debt income ratios. Couple things with student loan debt. For manageable student loan debt levels, one of the recommendations is not to take out more student loan debt than you will make in your first full-time year of work. Another study I didn't put on here for PTA debt, I just did last year, found that it was like 85% of PTA graduates surveyed had less student loan debt than what they would expect to make in their first year of employment, but it's just the opposite for PT students. It was about 75 or 80% of students had more student loan debt than they would make in their first year. For the average debt in this research study, this is how much, if someone had this much debt from a public school here or a private school, these are the averages. If they had a standard 10-year repayment period, this is what their average, this is what their monthly student loan payment would be. So you can see a lot of people would not be able to afford $1,500 a month and meet the guidelines for how much income to debt ratio. Even a 25-year repayment plan, it can be high. A graduated repayment period where you pay less initially, but more later on, but overall you pay more interest, can still be pretty high. So that's kind of a bummer. Didn't mean to bring the mood down a little bit. Productivity and burnout too. It's important to where you're going to be working to understand what the productivity requirements are and to figure out what the expectations are. I've heard of some crazy productivity requirements where they say we have to be at like 125% productivity, which is pretty impossible to be while still being ethical. This was, I think, the most important research study that came out last year in regarding physical therapy. It's a guy from Texas did this. He surveyed PT and PTAs in Texas about productivity and what happened with ethical behavior. And he asked how high were productivity requirements. What he found was as productivity requirements increased, so did the rate of observed unethical behavior of PT and PTAs by their colleagues in their department. They found skilled nursing facility PT, PTAs were the most. They were 4 times more likely to having observed unethical behavior, primarily meaning unethical fraudulent billing, just to maintain their high productivity levels. And only less than 40% stated their culture emphasized ethical practices compared to a national average of all businesses of 66%, which is, I think, very concerning for the profession. This study also asked individuals how difficult it was to meet your productivity requirements. As you can see on the right here, most people said it was difficult or very difficult to meet them, and probably a lot of them were impossible to meet. And another thing too is how much participation did they have in the requirement? And most individuals said they had no say, or their colleagues in the department had no say of what their productivity would be. Some of the conclusions of the study stated that organizations that emphasize productivity over evidence-based practice were 6 times more likely to have observed unethical behavior. So that is very concerning, that where you're working, it's really going to be important. Business pressures towards overutilization of therapy and productivity often are accompanied by a gradual shift in the attitudes of clinicians who tend to justify overutilization of rehabilitation services by portraying as meeting their patients' needs or desires. And you got to be careful with that too. I don't know if you guys saw in your classes, did you guys talk about the, I'm not trying to pick on chiropractors, but did you guys see the study on the chiropractor last year in Thief River Falls that is now in federal prison? You guys talked about that? Okay, so there's a chiropractor in Thief River Falls. I'm going to mention it because it was close by. He's in prison now for fraudulent billing of, I can't remember the amount. It was a huge amount. One thing he did, they found out, was he had like therapy ball chairs in his waiting room. And over a long period of time, I'm not sure if it was a year or two, every patient that sat in the waiting room waiting for their appointment got billed 1 unit of therapeutic exercise for them sitting on the therapy ball chair in the waiting room, reading a magazine, waiting for their treatment. Which you obviously can't do that. Another thing they found out was this individual used, he had open houses. One thing was for Valentine's Day, people came in. There was over 200 people that came in for cake and stuff for the open house and door prizes. Everyone wrote their name down. He fraudulently billed every single person that came in for an open house saying they received medical services that day. And I'm not trying to pick on chiropractors. There's physical therapists who have been caught with this too, or PTAs. It's a local thing, so I wanted to bring it up. And you know, the therapy chair billing people for sitting there waiting for their treatment, I think is crazy. Productivity and PTA and PTs. This was a study that I presented last year at CSM, part of the one in Wisconsin and Burnout. we looked at productivity requirements and burnout, and people with a productivity requirement had higher levels of burnout in all three areas: more emotional exhaustion, more depersonalization, and they had less of a feeling of personal accomplishment about their job. So that's one thing you want to look for too. Most places have productivity requirements, but looking for a job, just ask if they're realistic, or ask other people there if they're realistic. If they're expecting you to be at 100% productivity where you're not even going to have a chance to go to the bathroom throughout the day without meeting the requirements, it's something to think about and talk with who you're going to be working with. Two other portion studies looking at productivities and PTAs. On the left here, this was a study with PTAs in Washington. Most PTAs had a productivity requirement. Most of them had a productivity requirement over 85%, where the expectation was 85% or above of their working time needed to be billable time. Another study on the right found, similar to PTs, PTAs with a productivity requirement had higher levels of burnout, specifically emotional exhaustion. This was interesting. One of these PTA studies had an area where people could write in comments. And some of the comments I received were crazy about what people put for their responses. Here's a couple of them right here. This is going to be from PTAs. So this is up the top. Someone say they have to see a patient every 40 minutes. They're required to bill 4 units per patient. And they see 10 patients in 10 hours. They have to bill 60 units in 10 hours. So that's a lot of units. I don't know how you could do that ethically. It'd be pretty difficult. Another one, they stated they're required to bill 4 units per hour for Medicare, 5 units per hour from private insurers, not counting modalities, or 5 units per hour. And that's pretty tricky, I think, getting 5 15-minute units per hour. I'm not that good. I don't know how you can do that and still maintain ethical guidelines. Another thing it's important for students to know is, unmet expectations. They found unmet expectations can increase the risk of getting burnout. So if you have, if you're comparing your upcoming professional organization to previous experiences, what you learned about the profession in school, your clinicals, that will lead to, where if you come in with more realistic expectation of what's required, that will help. One study found that new graduates might be more prone to burnout just due to these unrealistic expectations. They think this is why potentially they found younger workers are more burned out than individuals later in their career, is right away you might not know what to expect as much. Well, that's one nice thing I think in physical therapy with clinical education. You get so much time in the clinic where you can really kind of see what the expectations are prior to graduating. You can see many different clinical settings. One thing I was going to mention too is with productivity and student loans, I was presenting a research study at a conference at CSM a couple of years ago, and this physical therapist came up to me and he looked kind of rough, and he talked to him a little bit. And I don't know if you guys saw the old movie Grumpy Old Men, but I kind of feel like I'm concerned that some of these issues are going to turn young therapists into grumpy old men or women. So this is kind of what he said to me here.
Justin, there is a question in the chat as well.
Yeah, great. Let's hear it.
I think it goes back to the quotes that you had on productivity, and someone asked if that's just what that specific company requires in terms of productivity standards.
Oh, yeah, that was a lot of people wrote their individual requirements for productivity. Yeah, so the survey results, people were just saying what their productivity was, and I was kind of just saying, if you have any comments about your productivity, and some people wrote like a paragraph or two, people were kind of venting, and that wasn't even part of my study. It was all more of a quantitative versus a qualitative study, but a lot of people did put that information down. Electronic medical records is another thing too, that a study found that the higher utilization of electronic medical records by physicians leads to higher rates of burnout and lower job satisfaction. These were initially made to try to make things easier, but study after study have found that the more you use electronic medical records throughout your day, the more burnout you're going to have. And most places use them. You can't get away from it. You can, though, if therapists are involved with the templates on them, that can help a lot. That can increase autonomy and make things easier to do. I know of a couple places that Therapists had no say in how their templates were for like Epic, and administration said, we're not going to change them. You get what you get. We're not going to change them at all. And they have to work around them, and it's pretty tough. One reason why electronic medical records, here's some with the job person fit, why more electronic medical records may increase burnout. It can be insufficient rewards. It might be unpaid overtime of you working over your lunch break, just doing charting or staying after work. Might be perceived as, again, increased workload. This was an informal survey I did a couple of years ago for another presentation of just PTAs coming up. I'm going to show you the next slide. What I did was I said, can you complete all your electronic documentation during the workday? Or do you stay after? How much off the clock time do you spend a day doing your charting? So again, not being paid, because a lot of people, they don't want to decrease their productivity standard that they have. So a lot of people will end up working off the clock. And I chose PTAs because PTs are often salaried, but PTAs are primarily more hourly. So green here says people can complete all their documentation during their workday, so they're paid for it. Here, individual state, they tend to normally spend 1 to 2 hours a day completing documentation off the clock. Yellow is, 0 to 1 hours, 1 to 2 hours, 2 hours a day. So there is 1/4 of the survey respondents say they spend 1 to 2 hours or more a day completing documentation off the clock. Because if they do it on the clock, their productivity rates are going to plummet. So that's kind of scary too, thinking about that. With this too, this was a survey I did on a PTA page on Facebook. There were some great comments people had. I'm just going to let you read these here. I thought they were kind of humorous. They're all very similar. It all mostly talked about, sucking the joy out of your life is doing documentation. Some people too mentioned that they hated the fact that they had to document while they're working with their patients. So they felt that it was kind of more impersonal having a laptop in front of them while their patients were doing exercises. And sometimes they felt they had to do easier exercises with their patients for everything they didn't want to do due to getting their documentation done. Okay, so what are we going to do about burnout? There's some few strategies you can do for individuals and institutions. One thing is just focus on job engagement. Try to get engaged with your job. That could be everything from getting more involved with committees at the job, trying to really get a social network or a sense of community with your coworkers. They found can really be helpful too. Healthy lifestyle, there's a couple slides I'm going to show about that. That is really important too. And getting involved in your profession, whether it's through the APTA, doing continuing education, that will just help build your social and your professional community and help with support. This is a study on physicians of 104 physicians, and what they found was, here is the mean hours of sleep a night, and the mean hours of sleep was about 6.6 hours, but they found that sleep was one of the biggest risk factors for developing job burnout. And if you were sleeping under 6 hours a night, that was the main risk factor they found from all these personal things they found. They just kind of looked at more personal habits. Another one is exercise. They also found, this is physicians as well, they found that less exercise was associated with increased rates of emotional exhaustion. So this is one they really recommended as part of just staying healthy in general. If you have a maintained exercise, even if you have a stressful job, that can help decrease emotional exhaustion. I want to mention another thing about autonomy too. They found that autonomy is a really good buffer. Studies have found between high job demands and burnout development. If you have a very busy outpatient clinic, let's say you're working in, that maybe still has a high productivity requirement, but you have really high levels of autonomy, burnout levels are still very low, not high. So if you have more flexibility of your work schedule, how you can get your work accomplished, that's really helpful. Studies have found that autonomy is really important to help decrease the amount of burnout you can have in a high stress environment. Humor is helpful too. A lot of studies have found humor can be an effective coping mechanism. So they say that's going to be important with your colleagues, just getting a good sense of community at work. And there's a lot of studies saying that they call it work resilience. Like it's going to be good just to, they kind of say that same thing about just decreasing burnout development. Helping others and accepting help is big. They say that can be helpful. Developing realistic goals, having a positive view about your job, and again, just self-care, exercise, diet, well-being, all that can help. I want to mention something about social support again too. They found that again, social support is really important. Getting a good professional community, that can really help people. Support can help individuals redefine the potential harm in the situation, or it can enhance their belief that they can cope with the situation by perceiving that others are providing needed resources. Studies have found that too, perceived support from coworkers or supervisors also has less burnout. And that's important too for individuals that are supervisors to provide enough support to their employees to make sure everybody's getting their needs met. Another thing as students is be open to opportunities. There's a lot of hidden opportunities out there in physical therapy. And I'm not saying hidden, but things that people don't really know as much about that just get more involved with your institution. If you're at a large hospital system, a lot of those places are always asking people to be on committees, and that's really a good way just to get more involved. There's task forces, they're looking for volunteers. There's potentially practice areas to develop. I know a lot of people that have developed whole new specialty areas for a department by showing interest, then going to continuing ed, and they get to do, it just keeps things interesting. Profession, you can get board credentialed, such as your OCS residencies, which I know you guys have talked about. There's good mentoring you can sign up for through the APTA. A couple of cool things too. You guys are all going to take the Federation of State Board of Physical Therapy exam. There's a great opportunity for PTs and PTAs where you can actually write questions for that exam. You can volunteer for that. It's a great opportunity. You meet a lot of people. Well, in the olden days, they would fly you to Washington, D.C. Hopefully they'll be doing that again next year, where you spend a few days there, they pay for everything, and it's just great. There's a lot of organizations like that you can get more involved into. Professional association, I think, really helps too. Being a member of your state chapter after graduation, they're always looking for people to be on committees, things such as PT Pub Night. Being a clinical instructor, that's a really good opportunity too. Some studies have found that decreases burnout rates too. In community, volunteering, medical mission trips, it's a way you can use your professional knowledge. Side gigs too. I know one person that was working full-time and mostly to decrease student loan debt was also working every weekend in a nursing home almost, and that might be harmful for burnout, but it might be something where there's other things you can do too. I kind of fell into teaching. I graduated from PT school in May, and I got a job teaching adjunct anatomy and physiology at the University of Minnesota Crookston and at Northland College 2 nights a week that fall when I graduated. I kind of completely fell into it. And that's the thing too. I know a lot of, a lot of physical therapists that have contacted local community colleges, maybe teach an anatomy lab or medical terminology or something, even online. So there's a lot of side gig opportunities to use your knowledge as well. Same thing for research. If you're interested in research, contact individuals at the DPT school closest to you. There might be some research you can do even in your clinical environment. So there's a lot of different things I think you can do if you're open to different opportunities. Institutions too should be helpful, be doing some things to decrease burnout. Improving PT autonomy and scheduling, letting people maybe even change how they're gonna do their hours. One clinic I worked at for a couple of years, outpatient clinic, it was great. They let you pick your hours. They're like, okay, you have Monday through Friday to get in 40 hours. Here's the hours we're open. When do you want to come in? And it was nice. I worked, I think, 3 10-hour days and then 2 5-hour days. They didn't allow you to work 4 10s there, but it was still nice. 2 days a week, I worked from 7 till noon, and then I had 2 afternoons off, which was great. So I really felt like I had higher autonomy there for my schedule, and I could change it to make it seem fit. Productivity requirements is a big thing too for institutions. You need to have a certain amount of billing and money coming in for an institution to stay open, but getting clinicians involved with what productivity requirements are can be helpful. Focusing on improving community can be good through some places have journal clubs or other things, getting individuals together. Providing adequate continuing ed funding. I've worked at places that had great funding and no funding for continuing ed. And the places with no funding for continuing ed, people were a little upset about it. So providing enough professional development opportunities is good. Fairness of scheduling is good too. I spoke to a large hospital system last winter in Kentucky about burnout. They had me come and talk to them, and it was interesting. There it was like 5 hospitals. I found out that the weekend scheduling was all over the map. Some people didn't have to work weekends, some did. And there's a lot of contention between the departments. So that really people thought it was unfair. So making sure institutions keep things fair is important too. Tammany, this was the author that looked at productivity requirements and unethical behavior. He also just recommended promoting an ethical climate. Institutions really should focus on ethics and high quality patient care. Shouldn't focus on, make sure that people aren't overbilling and doing things unethical too. Okay, we are near the end here. So it's, yeah, Zoom presentations are kind of strange. So we are kind of a little bit, I think, potentially, I guess we're right on time here about. So I don't know if you guys have any questions at the end here about burnout as a student, what you should know or what to look at for your first job about some of these issues. So the floor is open to you guys for questions.
I had a question about the electronic medical records and how that contributes to burnout. Is it just that there's more documentation now than there ever used to be? Or is it just that it was such a transition going from dictating things to typing everything up?
Nope, it's not the transition, because even new graduates who never had to write notes tend to say it's more, the more you do. It's because mostly it's just, it takes longer. It takes longer to do, and there's more documentation to do. Any other questions? Oh, there's got to be one more question out there.
I have a question.
Yeah.
How do you manage burnout for students? What's your advice?
That's completely different, I guess. There are some studies out there for burnout of PT students, and I laughed because one of them, again, they're like, we ask students at the end of a semester if they're burned out. And of course, PT students are going to be burned out near the end of the semester.
Well, I'm a first year student.
First year student.
We just started last week, so everything kind of feels like it's
sure.
After just 1 week, it's a lot.
You bet. I got it. Okay, so that I think scheduling is important. I know my first semester of PT school, it was very stressful. I don't think I watched TV at all that semester. I just set up a really high quality schedule, and I think scheduling is important. Set time aside, making sure. I don't know. For me, I know I always had to study. I'm like, okay, I'm going to study from whenever. My studying's going to be done from 7 to 11 every day. I'm going to study then, and that was kind of my time where I wasn't going to. I mean, we didn't have cell phones back then, so that was nice, but didn't look at TV or anything like that. I think exercise is important too. Still take care of yourself. You don't want to get sick. Sleep enough, but it's a lot. And ask classmates for help. If you're better studying by yourself, I guess that's okay, but sometimes doing some studying with classmates can help too, and trying to find that balance. I know, whatever you can do to share the load. Some things that we did in school, in PT school, that first semester is, I remember I can't remember what class it was, but we got into groups and everyone would kind of summarize information from textbook chapters. 5 of us would. We would each take a chapter and then share the summaries with each other. And some things like that really helped. We also made fake multiple choice questions on the material and then shared them. We'd say, okay, chapters 1 through 5, I'm going to write 20 multiple choice questions on this, and then everyone did. So we shared them because, I wrote my questions, so I knew the answers. So it was kind of interesting that way to help you study too. Kind of like Quizlet, pre-Quizlet, I guess is what we were doing then too. But I'd say just try to keep a good schedule and just make sure you take care of yourself, and you'll get through it.
Thank you. I appreciate that.
Any other questions about burnout, productivity, student loan debt, any of that fun stuff? Well, no questions. Well, okay. Well, thank you guys so much. I think what I will do too is I'm going to send Holly just a handout for this presentation if any of you want it, for any of the information on there too. And if you have questions after this, my email will be on that handout. So just please feel free to contact me if you have questions about any of these topics, and if you'd rather just contact me individually, or if you have any questions on any of the research and you'd like to get those actual articles or anything too. All right, thanks again. Have a good rest of the day.